Hey there VCE HHD students, my name's Andy, I'm a VCE Health and Human Development teacher. In this short video we're going to look at answering the 2020 VCE HHD exam, question number 8. Before we dive into question 8, just a reminder at the Health Resources Hub YouTube channel, a new video like this one is coming out each day between now and the HHD exam this year. You can subscribe with the button in the bottom corner of the video there. Please let your HHD friends know they can do so too to access all of those videos. I'm running the 2 ACE HHD exam preparation sessions over the September break. The first one's less than a week away. You can book a spot to those at book.acedvce.com. You'll get a great set of notes and we'll go through exam strategies and tips. There's our social media links if you'd like to follow us and get alerts to the videos coming out each day, and also our email if you've got any questions or suggestions for videos you'd like me to work on. So question 8 in the 2020 exam was worth 6 marks. You can see here it started with some stimulus material, the Aboriginal and Torres Strait Islander Sexual Health ASH program. And so you can see that program there talked about the WA AIDS Council was working to provide holistic and culturally appropriate services for Aboriginal and Torres Strait Islander communities in the metropolitan area and rural remote areas of Western Australia. It went on to talk about some of the principles of the program and talked about then after that how they provide tailored HIV/AIDS education and prevention knowledge and training in Aboriginal and Torres Strait Islander communities and organisations and non-Aboriginal organisations, etc. So A for 3 marks was asking you to explain how the ASH program can lead to improved health and wellbeing outcomes for Aboriginal and Torres Strait Islander people. Now, I find sometimes 3-mark questions can be a little bit confusing for students. It's not always clear how much detail is required. So for an example like this, I'd probably make sure that you are linking to at least 2 examples of dimensions of health and wellbeing. So you can see here that 18% of the state was able to achieve 3 marks for this particular question. And so it mentioned in the examiner's report that students could make fewer links with more discussion or more links with less discussion for 3 marks. And so that's what they're talking about in relation to the dimensions of health and wellbeing. You can see they provide an example of a high-scoring response there that talked about the ASH program improving health and wellbeing outcomes for Aboriginal and Torres Strait Islander people as those healthcare services were culturally appropriate, meaning they'd have lower levels of stress and anxiety when accessing healthcare, which would promote their mental health and wellbeing. And then they also said that this cultural appropriateness means more Aboriginals would access health services, allowing illnesses to get treated, which could promote physical health and well-being. So you can see there they've made links to 2 dimensions of health and well-being with aspects of the program included there. B was then asking you to identify 1 principle of social model health and explain how it's reflected in the ASH program for 3 marks. So you can see there they included a line for the principle. So remember the principles are things like addressing the broader determinants of health, acts to reduce social inequities, empowers individuals and communities, acts to enable access to healthcare, and involves intersectoral collaboration. So there's a number of those that you could have chosen to link to this program. I always say to my students that if the program that you're provided includes an aspect of education or skills training that empowers individuals and communities is always a good one to choose, because if people are increasing their knowledge and skills, they're more empowered to take control over their healthcare. And so you can see in the examiner's report they provide an example there where they did use that principle. The explanation was that because the program provides HIV/AIDS education and prevention knowledge that empowers Aboriginal and Torres Strait Islander people to make informed decisions to improve their health and well-being, okay, and they're also involved in the planning of healthcare, which empowers the community. So that's a good one to look out for. There were others as well. They were talking about partnerships that were a part of that program, so you could have talked about different sectors and groups working together and linked that to involves intersectoral collaboration. Okay. Hopefully you found that video useful. A reminder, there's the Health Resources Hub YouTube channel, the ACE HHD exam preparation sessions, our social media links, and our email. Thanks so much.